Hello, today I'm talking about facelift and neck lift scars, how to get the very best scars when it comes to facelift surgery. My name is Dr. Julian De Silva. I'm a facial cosmetic surgeon based in London in Harley Street, and I specialize in only the face, and I've been doing this for more than 10 years. And so I'm going to talk to you about my experience over these years. Well, scar design in front of the ear is very important because how the scar is designed can literally define how visible that scar is. Now, we have natural curves around the ears, so we can curve our scars round the natural curves, and that definitely takes additional time to do. However, it does mean the scars can be very difficult to see because they're virtually invisible depending on how you heal. In front of the ear, we need to be cautious. Some doctors can use scars that are in front of the ear like a straight line. However, those scars are definitely more visible, and although they save time, ultimately we want the best results, and that comes from concealing the scars in the natural curves. And then how about the hair? Well, the hair is very important because we do not want to raise the hairline, and certainly facelift surgery where everything is lifted, if the hairline's lifted higher up, it doesn't look natural. So it's very important to conceal the scar in a way that it doesn't lift that hair. Now, if you have a lot of loose skin, it's very important that this hairline doesn't move, and sometimes in those patients the scar should be hidden just underneath this kind of tail of the hair, because that means the hairline doesn't increase. If you have minimal loose skin, well, the scar can be taken into the hair and then it's going to be hidden within the hair. Now, high hairline is definitely more noticeable. This is a patient who came to see me for revision facelift surgery where their hairline has been lifted from this area more than a centimeter up, and it really just doesn't look natural. And the only way to improve this is to revise the surgery, do revision facelift surgery where that hairline can be brought down at the same time as lifting areas up. How about behind the ear? Well, behind the ear is also very important because particularly if you have shorter hair or you wear your hair up, well, this area can be more visible. Now, the length of the scar in this area is really defined by how much loose skin you have. If you're a younger person and you have quite minimal loose skin, the scar could be hidden just right behind your ear and virtually invisible. If you have 1, 2, 3 centimeters or more of loose skin, well, the scar needs to come down a little bit within the back of the hairline. And the reason for that is, it's a bit like if you have a curtain. If you have a curtain and you close that curtain, well, when you close that curtain, because it gets all pushed together, you get pleats in the curtain bunching. And the same thing will happen with skin. If a very small scar is made here, you'll get pleating in the skin that won't look smooth and natural. So the scar really needs to be taken in context with how much loose skin you have. Now, the other aspect of scar design is having a beveled incision, and that is really going into the technical details of how this surgery is done. So where there's hair-bearing skin, which might be in front of the ear around this area, or behind the ear where the scar is taken towards the hair, if the scar is just made as a straight line into the skin, when that heals, the scar can be seen because it's at the very edge of the hair. If I use a beveled incision, that means the scar is taken within a curved line, so it's beveled into the skin. And that means that although the surgery is done to at this point, similarly to the diagram above, because the beveling of the scar, although initially it cuts through these little hairs, the hair follicles where the hairs grow from will grow through the scar. So the benefit of doing a beveled incision is the scar becomes more discreet with time because hairs grow through it. So even though in this area the scar is right at the edge of the hair, in the second picture with the beveled incision, the scar is hidden within the hair. And that can work really well because it means the scars are much more discreet. Now, in men, we have a further consideration, which is beard growth, because beard growth can ultimately determine how much hair comes up towards your ear. And because the beard growth moves only millimeters in younger people, well, that won't affect how you need to shave, and that can give a really discreet and fine scar. If you have like significant beard growth and significant loose skin, well, when that 2-3 centimeters of loose skin is taken away and everything is lifted, your beard growth will grow all the way to that part of the ear, the tragus. Now, for some patients, that's absolutely fine. They're not bothered by it. And of course, things can be done to minimize that loose hair. You can treat the hair so it doesn't grow in that area. For some patients, rather than taking the hair all the way towards like that part of the ear, it can be better to make a decision to make a scar in front of the ear. And then of course, the beard will never move past that point. And that, of course, means a discussion with your surgeon to decide what is going to be the best option for you, bearing in mind how much loose skin you have in terms of, do you generally have like a little bit of a beard, or are you clean shaven? So they're these things that need to be taken into consideration. So what about some patients who have no hair, complete alopecia? Well, we still want to use the natural curves that you may have. Like if you have multiple lines just around the ears, we can use those natural lines and curves. And then we just need to be meticulous. We need to be meticulous with all the things that we've talked about so far. The scar design, what method is used to close the skin, at what time those stitches are taken out. We want to take all those measures and curving the scars, and this is about 2 weeks after surgery. So the scar is, well, we can see where the scar is, but already it's healing, and the final result of these kind of scars is as long as 18 months. And so at that point, the scar is going to be really quite discreet and difficult to see. We can also use other techniques. We can use regenerative medicine. And that means using your own growth factors to heal you faster and improve the scars. We can use silicone gel that helps with remodeling of the collagen of the scar to heal those scars better. And then the final element is genetics. Like some people just heal really well, and some people can heal with more prominent scars, and that's an element that's more difficult to control. Now, I do hope this information has been helpful for you, and if you have any questions for me, do not hesitate to contact me. Thank you for watching.